How does a child's UTI become dangerous urosepsis? Imagine a small infection in a child's urinary system that suddenly turns into a serious health problem. When bacteria cause a urinary tract infection in children, it usually starts in the bladder or urethra. If not treated properly, the bacteria can climb up into the kidneys, leading to a more severe infection called pyelonephritis. This is when the kidneys become inflamed and infected, and symptoms like high fever, back pain, and chills may appear. If the infection continues to spread and is left untreated, bacteria can enter the bloodstream, causing bacteremia. This means bacteria are traveling through the blood, which can trigger a widespread immune response called sepsis. When this response becomes overwhelming and uncontrolled, it can damage tissues and organs all over the body. This condition is known as urosepsis because it originates from an infection in the urinary tract. Children, especially infants younger than 3 months, are more vulnerable to this progression because their immune systems are still developing. Other factors that increase the risk include urinary tract abnormalities, nerve problems affecting bladder control, recent urinary surgeries, dehydration, vomiting, or if the child cannot tolerate oral medications or fluids. Children who have had recurrent urinary infections are also at higher risk. The process usually begins with a simple urinary infection, causing symptoms like fever, painful urination, or frequent urination. If untreated, bacteria can ascend to the kidneys, causing more severe symptoms such as high fever and flank pain. From there, bacteria can enter the bloodstream, leading to systemic infection. When the immune system reacts excessively, it causes widespread inflammation, which can lead to organ failure if not managed quickly. Treating a UTI early with antibiotics is crucial to prevent this dangerous chain of events. In some cases, especially if the child is very young or severely ill, doctors may give antibiotics through Roman 4 to ensure the infection is controlled rapidly. Supportive care like hydration and close monitoring are also important to help the child's body fight the infection. If urosepsis develops, it can cause dehydration, imbalance of electrolytes, and long-term damage to the kidneys, especially if the infection recurs or is severe. Children with urinary tract abnormalities are at even higher risk for these complications. In summary, a child's urinary tract infection becomes dangerous when bacteria spread beyond the urinary system into the bloodstream, causing a body-wide inflammatory response. This can harm multiple organs and become life-threatening if not treated promptly. Early diagnosis, appropriate antibiotics, and supportive care are essential to prevent serious health problems. Always consult healthcare professionals for proper diagnosis and treatment to keep children safe and healthy.